Hi everyone, I'm Karl Fagerstrom, and I will be talking about the Swedish experience and the new nicotine pouches. Slide, please. So on this slide, we see the Swedish tobacco habits over the last 100 years. And as we can see, 100 years ago, the blue line snus was more common than cigarettes, but cigarettes, as in most other countries, were going up. Snus was not very much forgotten until about the middle of the 70s, when snus started to be promoted and marketed again, and it increased and cigarettes decreased. As we can see in the next slide, the smoking prevalence in Sweden is very much lower than in any other of the European Union countries. And actually also for the tobacco endgame definition of less than 5%, Sweden is less than 5 and has reached the endgame. However, prevalence of smoking, I wouldn't care very much whether they're high or low if the harmfulness of smoking was the same as coffee. Who cares if in one country they drink more coffee or less coffee? What really matters, that is of course what we see on the next slide. That's the death and disease that follows. And here we have some WHO data, death rates per 100,000 attributable to tobacco. And if we look at the European Union with its median, maximum country and minimum country for men with lung cancer, we see that the median is 220 per 100,000. The lowest is 91, but Sweden is lower than that with 87. Other cancers, the lowest in the European Union, 41, except for Sweden, which is even lower, 36. And if we go to all cardiovascular diseases, it's 170 in as a median for European Union, the lowest country apart from Sweden, 107, and Sweden 72. So Sweden is an outlier when it comes to lung cancer, other cancer, and cardiovascular, and most likely diseases and death overall. If we look at another data set from the global burden of disease, we see very much the same. For the total population of men, Sweden has a figure of 70, while the other lowest country in the European Union 76. And if we have a more narrow age bracket of 50 to 54, we see an even stronger difference. There Sweden has only 38 compared to average 130, and minimum country apart from Sweden 61. In the next slide, we see what is very important, and that is namely that there is a kind of quasi-experiment that has been going on in Sweden. The active group has been the men that have used snus. The females have not really taken on to snus to the same extent at all, and therefore they can be considered as the control group. And here we see total death attributable to tobacco in the European Union again, and for women the figure is 44, but for Sweden the figure is 52. So Swedish women have a higher death rate than the average European Union death rates. So it's the man that has entertained the reduction in death and disease, and not the women. And in the next slide, we see that this is, of course, having consequences also, so that the Swedish snus was the first and so far the only product to be recognized as a less harmful tobacco product by the Federal Drug Administration in the US, and there is some detailed text here that we don't need to go into, but it does reduce the risk for a number of diseases. Now I will turn in the next slide to the nicotine pouches. Sonic was the first nicotine pouch to be developed by Niconovum, a company that I started and where I was keen to develop products like this. And in 2008, that was registered as a medicinal, so-called nicotine replacement product. Since there has been many more similar products developed by the tobacco industry, and most, if not all, of the big tobacco companies today have their own brand of nicotine pouches. In the next slide, we see the composition and the ingredients of in the next slide. So in this slide, we see the ingredients of the nicotine pouch, which is registered as a medicinal product, the market leader, and compared with Nicorette chewing gum. We have pharma-grade nicotine in all of the products. For the nicotine pouches, we have nicotine bound to the microcrystalline cellulose. For the gum, it's to gum base, of course. And then we have two other classes of ingredients, and that is flavorings and buffering agents. And ingredients are very similar across the products and across the product category, chewing gum, NRT, and nicotine pouches also. If we move to the next slide, we would think that the similarity in composition would also show up in similarity when it comes to the health and the adverse effects. And here we can see a study where some 20 toxic and potentially toxic substances has been assessed from nicotine gum 4 milligram and lozenge 4 milligram. And we have the averages in this column and averages for 4 different nicotine pouches under the brand name Lift. And what we see here is simply that there is absolutely no difference in exposure from the nicotine replacement products and nicotine pouches. The values are usually hovering around the level for detection. So I would think as we go to the next slide, where we see that there is a continuum of harm, which I will not be talking much about because we have the author of this paper and this figure, Rachel, that will be talking later in this session. But we see we have nicotine pouches to the very end here together with nicotine inhaler, which makes sense. Next, we can ask how is long-term use of nicotine regarded today? There was a time when the nicotine replacement products, they were on prescription and for short-term use, and regulators and physicians thought their nicotine was much more toxic and harmful than it actually is. Today, we can see that the regulators like MHRA in the UK, they say they indicate nicotine as a safer alternative to smoking and can be used long term. So that is clearly an outright harm reduction. And in the US, use of NRT products with cigarettes or with other nicotine containing products does not raise significant concerns. Current marketed NRT products do not appear to have a significant potential for abuse dependence. So if this is true for NRT products, with a very similar composition of the nicotine pouches, should that not also be said for the nicotine pouches, what has been said for nicotine replacement products here? We go to the next and second to final slide. We get into flavors. And I think flavors can be important for adults to have the products acceptable. But I think there is a risk that we create something similar to Julgos, where the marketing is too free, that it goes very much up, sales are good, but also this sensitizes the presentation of the products here, looks to many like candy. And I think this sensitizes not only the most radical anti-tobacco advocates, but a lot of people. We do not need 50 or 100 variants of flavors. We need a few flavors, and that will be seen as much more acceptable by the society at large. I would like to say, though, that I think also that flavorings in terms of toxicity will probably be less of a problem with a pouch product than when inhaled into the lungs, like from electronic cigarettes. And the final slide is my conclusion then, which is tobacco-free nicotine pouches are likely to have the best potential for harm reduction among smokers who switch completely and among naive subjects who otherwise would have started with other nicotine and tobacco containing products. Thank you very much.